We used information from the 2009 Northern Ireland House Condition Survey, and we found out that 20% of the housing stock had a Category 1 hazard. That is a hazard that was really seriously impacting potentially on the health of the people who lived there, particularly a vulnerable person. And when we applied the model that we developed at the Building Research Establishment, we found out that this was costing the National Health Service in Northern Ireland about £33 million per year in first-year treatment costs alone. I said this was work we did using an old survey back in 2009. We've recently reworked our figures using the latest English housing survey, reapplied them to Northern Ireland, and found out that this figure probably was much greater. We're talking about £77 million a year. And in fact, the knock-on effect of that on someone's life chances, if someone, for example, falls down the stairs and is injured in a poor quality house, the knock-on effect from that affects the rest of their life. It's not just 1 year treatment costs. It's the effect on their life chances, their educational attainment, their earning ability, costs of care, costs of further treatment, and so on. And we worked out that 20% of the housing stock that has these hazards in Northern Ireland is probably actually costing Northern Ireland £1 billion a year in lifetime costs, in life chances according to the Poor Health. So it really does make sense to improve poor housing and build as healthier housing as you possibly can for the future. One of the issues is people think that fixing housing is going to take a lot of money, but in individual cases it doesn't have to be that way. You can target particular improvements on particular situations, and they have really, really good payback times. Take, for example, the example of a vulnerable elderly person living in a home with a very poor, out-of-date heating system and poor insulation. That can be fixed quite effectively for perhaps, say, £3,500 to put in a new condensing boiler, improve loft insulation, double glazing. You don't have to do the full works. Just doing the minimum can actually raise the energy efficiency of the home up to an acceptable level. But by doing that, you're also probably taking the household out of fuel poverty, you're halving their fuel costs, you're halving their carbon emissions, and you're saving, we've done estimates which suggest statistically you're saving the National Health Service about £500 a year. And that work would pay for itself in NHS costs alone within 5 years.